A cyst is a nodule on the skin. Usually it has a little central punctum or a little hole in it, but it's typically firm. And underneath the skin, what it is it's a balloon full of oil and skin cells that shed into it. Oftentimes they'll increase in size. If any of that, the contents of a cyst get into the skin, it causes inflammation and pus to form. Cysts are typically not dangerous at all. So with my patients, I'll usually tell them, if you have a cyst and it's not bothering you, let's leave it alone. The one thing that can happen though is they can increase in size and they can rupture and become infected. Usually people come to me as a dermatologist after they've tried their own home therapies, squeezing them. Dermatologists will actually use a little blade that makes a bigger incision. So with that bigger incision, what we can do is we can squeeze out the contents. That's number one. Number two, a cyst will come back if you don't get the entire cyst wall when you do the treatment. So our treatment options include poking and squeezing it, or we can poke it and squeeze it and then try to scrape out the base or the balloon that's underneath the skin to get rid of it, or we can surgically excise it and try to get the entire cyst wall. And what's great is when we surgically excise it and we get the entire wall, it's very satisfying as a dermatologist to see that entire cyst come out unbroken. I think the statistic is about 50% of cysts that are removed will grow back. Dermatologists are experts at removing these cysts, and I think the recurrence rate in my hands is about 10%.